so welcome back from the break. Hope everyone's feeling a little bit more refreshed. Up next, we have Environmental Health Disparities Mapping Presentation and Exercise. And I'll introduce our two presenters. So we have Jennifer Sabel. And Jennifer has had a lifelong interest in public health, stemming from an early curiosity about differences in people's health. Her professional work in public health began with a training program at the Centers for Disease Control and Prevention. She has been working as an epidemiologist at the Washington State Department of Health for almost 20 years in different positions. The common thread in those positions has been exploring existing health disparities, and over those 20 years has come to understand how important environmental conditions are to the root causes of inequities. In her current role, she leads the Washington Tracking Network, where the Environmental Health Disparities Map is hosted, and was part of the team that launched it in 2019. And joining her is Allie Ertl. And Allie is a new epidemiologist with the Department of Health and will be helping to lead the work to implement the HEAL Act tasks related to the Environmental Health Disparities Map. She comes from the Centers for Disease Control and Prevention, where she was most recently working in the Division of Global Migration and Quarantine as the officer in charge of the Los Angeles Quarantine Station, and led a team of 40 in emergency preparedness and response activities. Prior to that, she worked as an epidemiologist in the Division of Violence Prevention, where her work focused on addressing the social and structural determinants of violence inequities and leveraging GIS to identify patterns of inequity and inform more equitable decision-making. She has a PhD in public and community health from the Medical College of Wisconsin. I'll hand it over to you two.
Okay, great. Let me just bring up my presentation here. Hold on a sec. Okay, can you all see that? Okay, so I just want to thank the organizers for inviting us here today to talk about the Environmental Health Disparities Map, which publicly launched in 2019. I'm going to give you a brief overview of the map, talk a little bit about the history, the theoretical model which the map is based on, and then highlight some of the features. But before I talk about the map, I just wanted to highlight all of the partners that helped and were involved in developing the map. And first and foremost is Front and Centered, which is a statewide coalition of organizations and groups that represent communities of color throughout the state. They were the initial organizing force for developing the map, being called to action by the communities that they represent. So the history starts with listening sessions with the vulnerable groups that they work with throughout the state to hear from them about their climate and environmental concerns. And listed on the left are some of the groups that they had these listening sessions with, and then on the right just shows a map of where these listening sessions were held. The first group were held in 2017, and then a few occurred in 2020 associated with the Environmental Justice Task Force. Okay, so when the partners were first looking to create this map, they looked at existing resources to help inform the development. And the two main ones that they looked at were this one, which is the Cal Envirus Screen, and EPA has an EJ Screen, which they also looked at. The group favored the California model mainly because they liked the theoretical model, which is that the overall risk of a community is a combination of the environmental threats and the population's vulnerabilities to those threats. This model and the one that we use in Washington estimates a cumulative environmental health impact score for each of the census tracts, and that score reflects both the pollutant exposures and the factors that affect people's vulnerability to environmental pollution. And this overall cumulative impact model is really one of the strengths of the map. It at least partially recognizes the complexity of the relationships between the different risks, and that many health disparities are associated both with the social stressors and the environmental risks, and that some health conditions in turn make people more susceptible to those environmental hazards. These models have been shown to increase the likelihood that disadvantaged communities will receive the critical attention that they deserve. So this schematic shows you all of the indicators that are in the Washington Environmental Health Disparities Map. And again, the map is a combination of the threats and the population vulnerabilities. The threats in our case are the environmental exposures and effects, which include fossil fuel pollution exposures. And the population characteristics include socioeconomic factors and sensitive populations. And sensitive populations are those groups that are more vulnerable to the environmental factors due to a biological condition that increases their susceptibility. For example, people with pre-existing heart disease are at a higher risk of mortality when exposed to various environmental stressors. And the model calculates an overall environmental health impact rank for each of the census tracts. I also wanted to add that while there are no specific measures specifically included in the model that reflect climate projections, the vulnerability factors used in the map highlights communities that will be and already are highly impacted by climate change. So I wanted to talk a little bit about the ranking. So there are 1,458 census tracts in Washington, and the way that the ranking is that it splits those census tracts into a score of either 1 to 10 based on the underlying data. Each of the census tracts typically have between 6,000 and 8,000 people in them. And this ranking is done not only for the overall score of the map, but for each of the 19 indicators and the 4 different themes. And these, the theme ranks are calculated based on an average of the percentile scores for each of the indicators in that theme. So then looking at this particular slide, the communities that are ranked an 8, of which there are about 145 census tracts in Washington, 70% of the communities have a lower impact, overall impact, and 20% have a higher impact. I also wanted to emphasize that these are relative rankings. So it compares that census tract to all of the other census tracts in Washington. It's not an absolute rank. So a score of 10 doesn't necessarily mean that a standard or a benchmark has been exceeded. And to determine this, you'd have to look at that underlying data. For example, many of the air quality indicators have national benchmarks, and the ranks don't necessarily tell you if the data is reflecting that they are above or below that national benchmark. So the Environmental Health Disparities Map lives on the Washington Tracking Network, and this is a screenshot of our homepage. It is one of 4 tools that that we have on the map, and the tool that it's hosted in is our information by location. There are actually 7 total maps in this particular tool. And I have included 2 different links at the bottom. This first one goes directly to the Environmental Health Disparities Map, and the second one is a little shorter, but it goes to the information by location tool, and then you have to select the Environmental Health Disparities Map. This is a screenshot that shows you what it looks like when you first land into the Environmental Health Disparities Map. And it shows on the map is those overall rankings. I also included a link to a video that we have that is about 4 minutes long, and it goes over all of the features within the map. So when you select one of the 4 themes or an individual indicator, the map changes to reflect that what you've clicked on. In this case, it's showing you this individual indicator of the particulate matter 2.5 concentration. And to access the data behind those rankings, you can click on this little chart icon here that's within the circle. And when you do that, you go to the underlying data. And this shows you 2 different screenshots. The one on the left shows you what you will go to if you clicked on that chart indicator. It goes directly to that particular measure, and it tells you some notes about that particular data. And then when you hit submit, it will give you all that data, and it will show you something more like the screenshot on the right. I just mentioned that when you select the one on the right, all of that data is downloadable should you need access to the underlying data. And I just wanted to show you this figure. So this shows the difference in life expectancy by the different ranks on the Environmental Health Disparities Map compared to the state average. And it shows you that there are real consequences to the difference in these overall ranks. This data shows there is a 5.7-year difference in the life expectancy between those populations living in communities with a rank of 1 compared to those with a rank of 10. And then before I just do a very brief tour of the map, I wanted to tell you what we've been tasked with related to the map in the HEAL Act. And I just wanted to highlight the first 2 here. We have been asked to come up with a mechanism to track changes in these disparities that we see over time, because the map shows you the most recent data that we have. And so we'll be working on that. And then the second one is that we are tasked with further developing the map, and in doing that, engaging with communities and other partners that are interested in helping us with that. So with that, I am going to just move to the map. on a second. Okay. So this is what it looks like when you land on the Environmental Health Disparities Map. And this shows you the overall score of the map. And when you click on each of the themes, it will then update the map to reflect those themes. And the same is true when you click on each of the indicators. I wanted to show you that there is a little place to zoom in on the lower right-hand side. And you can move yourself around by just holding the mouse and dragging to where you want to go. And when you click on one of the census tracts, it will show you the rankings overall and then for each of the themes and the indicators. It also shows you a little bit of information about the community that you've selected here. A couple other features. We do have two different color schemes on this map. The default is this purple, but you can also use the other color scheme, which is a blue to red. And then we have some features that are available here. This is shows you some overlay maps that you can use to give additional context. And I'll just show you the hazardous waste sites here, which will just take a minute to populate. And then you can click on each of them and it will give you a little bit of information about that. There is also a map locator, which you can enter a zip code or the census tract number here, and it will locate that on the map. Our information tab gives you a little bit of overall information about the map and includes the version that is published on the map. We've updated it once so far in late 2019, and this shows you that. And when we update it again, it will show you that there. There are a couple links. This top one is a mapping report that lives on the University of Washington website, and it gives you in detail information about each of the 19 indicators. And there are a couple links to the environmental justice information and an email where you can ask us any questions about the map. And then lastly is the getting started. And this one has a link to the videos, both in English and in Spanish. And with that, I am going to turn it over to Allie, and she's going to walk you through an exercise.
Thanks, Jen, and good morning, everyone. Like Jen said, next we're going to do an exercise together on the Environmental Health Disparities Mapping tool. A link to the PDF of the exercise is available in the agenda, and you can click the link at the top of that PDF to navigate to the mapping tool, or I'm going to paste a direct link to the mapping tool in the chat, so you can click on that as well. And just to make sure my internet doesn't lag, I'm going to temporarily stop sharing my video while I run through the exercise and share my screen instead. Okay, can someone just type in the chat to make sure they can see my screen? Awesome, thank you, appreciate it. Okay, so let's take a look at a few examples on how to use the Environmental Health Disparities Map in the Washington Tracking Network Information by Location tool in a few different areas. We're going to start by going through an example together in Tacoma, and then you'll have an opportunity to work on a Snohomish County example on your own. For those who do not have access to a computer to do the exercise, I will continue sharing my screen and walk through the example, but I'll put myself on mute so I don't interrupt everyone who's running through the example on their own at their own speed. So first, let's start out by selecting the environmental health disparities topic for the map. So this will fill the map with the relative rankings for the overall risk for each census tract in the state. So a census tract is a relatively small geography that's stable over time that we're going to use to represent a community. An overall rank of 10 represents the most impacted communities, and a relative rank of 1 represents the least impacted communities. All communities with the same rank are relatively similarly impacted. So a community with a rank of 9 is similarly impacted to another community with a rank of 9. So next, let's zoom into the Tacoma area by using the plus sign at the bottom right of the screen. Oops. And then by panning over. You can select a community by clicking on it, and you can see that we have a census tract in Tacoma selected now. You can get more detail about the general area by selecting the Earth map icon at the bottom left. So by selecting that, you can get some information about roads and cities, airports. It just gives you a little bit more detail for the background. After selecting the community, the topic menu will auto-populate the relative ranking of that community for the environmental health disparities topics, as well as the 4 themes that make up the environmental health disparities topic and the indicators displayed underneath each theme. Okay, it will also bring up demographic details for that community. So here you can see the pop-up of the demographic details. You'll get the population total for that community, as well as any changes in the population over time. You'll get the population by age and sex, as well as some demographic information by race and ethnicity. So first question, and you can, everybody can just put their answers in the chat, or if you want, you can raise your hand and someone will take you off mute. But what is the overall relative ranking for this community compared to other communities throughout the state? So as a reminder, the overall ranking is right here on the environmental health disparities topic. What is that rank compared to other communities? You can put your answers in the chat. Thanks, Sierra. Anyone else want to throw their answers in there? Okay, this community does have an overall rank of 10, meaning it is among the most impacted communities in the state. So as mentioned before, there are 4 themes that make up the environmental health disparities rank: environmental exposures, environmental effects, socioeconomic factors, and sensitive populations. Each one of those 4 themes is made up of multiple indicators. So next we're going to select the environmental exposures theme from the topic menu to display the indicators and relative rank of that community for each of these indicators. Diesel emissions, ozone concentration, PM 2.5 concentration, population near heavy traffic roadways, and toxic releases from facilities are the indicators that make up the environmental exposures theme. So next discussion question. Indeed, hi Kathleen, it is high. So how does this community rank on the environmental exposures theme? Again, you can put your answer in the chat. Yes, so this community ranks 10 on environmental exposures, meaning it is one of the most impacted communities for environmental exposures. So next, the next question is, what indicators under this theme appear to be affecting this community the most? So we'll scroll down, you can see all of the different indicators that go into environmental exposures. Which ones seem to be impacting the overall environmental exposure score? Can anyone throw their answers in the chat? Good. Any other answers? Perfect. Yes, that is correct. So this community ranks a 10 on both diesel emissions and populations near heavy roadways, which is likely driving that high rank on the environmental exposures theme. We mentioned that populations near heavy traffic roadways, you can see Highway 5 is actually one of the boundaries for this census tract. So that makes sense that it's a high indicator. So next we're going to try adding one or more overlay maps from the features tab. So we're going to navigate to the features tab, and then we're going to select some of the overlays. So for example, we're going to try selecting the tribal land boundary and the hazardous waste sites. Might take a second here to have those all pop up. So you can click on each one of these to get additional information. So one thing that's neat, if you click on the tribal boundary, it'll give you the name of the tribal community as well as the population. And you can click on other tribal boundaries to get that information as well. You can also click on individual hazardous waste sites to get the name of that hazardous waste site. All right. So it looks like we had a question in the chat. I love data. This is well thought out tool visualizer. I wonder if you have any suggestions on conveying bite-sized summaries to government officials, neighbors, communities. In other words, how do we best message these critically important information? That is a great question. Jen, anything that you want to share?
Nothing's coming to mind exactly. I mean, I think we've heard from a lot of government officials already, and that's some of the work that we're going to be working on as part of the HEAL Act to really convey the overall information. I think there is a potential for a lot of confusion because if they select an individual measure instead of the overall rank, then that creates a little bit of confusion. But we are definitely open to any ideas that you have on that.
And it looks like there was a question about PM 2.5. Looks like it was Brian answered that. Any remaining questions? Oh, okay. Looked like someone asked, where did those particles come from? Jen, is there anything you can share about the PM 2.5 indicator?
Well, Brian's already answered that for us.
Oh,
so.
sorry. Sorry, trying to look at the chat and the map. My apologies.
Yeah, no worries.
Okay, perfect. Okay. So before we move on, any other questions that I missed in the chat? I don't think so. Okay. Okay, so next we're going to move on to the self-directed exercise. So I'm going to put myself on mute. For those who don't have access to a computer right now, I will be going through the exercise in the background, but I would encourage everyone to pull up the map themselves and go through the exercise as directed in the PDF. Please feel free to put any questions or comments in the chat. I do want to point out that there is a remaining discussion question. So whenever you get to that question, and if you have any comments that you'd like to share, please feel free to put them in the chat. You can also, yes, want to put that link in the chat again now. I can put the link to the map again in the chat now. Let me just... Okay, so everyone, please navigate to the to the map, and we'll start going through the exercise.
Ali, there's a question in the chat. Somebody asking for some verbal explanation for what you're doing for folks who are on their phones.
Okay, yes, I can walk through that. I'm sorry, my internet connection seems to be lagging for a second and it's not refreshing the map. Okay, I'm going to close out of it and try to reopen it. Okay, that worked. So I'm going to reshare my screen. Okay, so we are back at the map, the Washington Tracking Network main page. We are going to look at a community in Everett within Snohomish County. So we are going to navigate by using the locate address tool. So as Jen mentioned before, you can put in a zip code, an address, or you can put in a census tract identifier. We are going to put in a zip code for Everett. So I'm going to use 98201 as an example, and then click find. And that'll help us navigate to Everett. Next, I'm going to click on the environmental health disparities to show all of the overall ranking. And we can zoom in a little bit more and click on one of those communities to get the detailed information and the overall ranking. So this community in Everett ranks an 8 on the overall measure. Next, what I want to do is give an example, is to compare this community, this census tract, to another that is more rural within Snohomish County. So what we can do is click on the map features. We can add the county boundary. That'll show us the outline of the overall county. And we can zoom back in. We can also scroll down to the map feature called Rural Urban Tiers. And that is going to add a layer to the map that if you click on it, it'll tell you what that community is classified as. It gives two different classifications. The two classification breaks it down as metropolitan versus non-metropolitan. And then there's also 4 classifications within that. So this one, if you click on the original community census tract within Everett, is considered urban core. So it is the most urban type of community. Next, we're going to, and I'm sorry, I'm going to have to minimize the chat. So if Jen or someone else can monitor the chat while I run through this, I just need to see my full screen so that I can show you all an example of a small town or rural community within Snohomish County. So we have to zoom out a little bit, because if you click around, all of these communities are not classified as a small town or rural. But if we move over here to some of these larger census tracts, we can find the small town and rural communities. So we're going to use this one as this census tract as an example to compare to that community in Everett. Okay, so we can go back to the topics tab. So I'm going to click this off. So we're going to use this census tract and compare it to the original within Everett. I'm going to click this off for now so that we can do some exploring within the topic selection. So first we can look at the overall relative rankings. So for the more rural community, click off the county boundary quickly. Okay. So if we click on that more rural community, we see that the overall ranking for that community is a 1. So it is among the least impacted communities in the state. If we click back in the Everett, that community within Everett, it has an overall ranking of 8, meaning that it is more impacted than the rural community. Next, we can click on the different themes to get more information to compare between the more rural area and the urban area. So we can kind of compare each of these each of these themes. We see that for environmental exposures, the more urban area in Everett has a overall ranking for environmental exposures as a 5. The more rural community has a ranking for environmental exposure as a 1. Let's look at environmental effects. So if you click on the environmental effects theme, you will see all of the indicators that go into that one. So we've got lead risk for housing, proximity to hazardous waste treatment, storage, and disposal facilities, proximity to national priorities list facilities or Superfund sites, proximity to risk management plan facilities, and wastewater discharge. So we can click on each of the more rural community within Everett and, the more urban community in Everett, and compare it to the more rural community in Snohomish County. So let's take a look at proximity to risk management plan facilities as an example. So if you click on that, the map will adjust to show the rankings for that indicator. So if you click on the more rural community within Snohomish County, you can see that it ranks a 2 for proximity to risk management plan facilities. In contrast, if you click on the more urban community within Everett, you can see that it ranks a 9. Okay, I am just going to do some clicking around for another minute to show some comparisons between the more rural community in Snohomish County and the more urban community within Everett. Please feel free to play around yourself and write any observations that you see in the chat. What changes do you see in the map when you click on those? What differences do you notice between the more rural community within Snohomish County compared to the more urban community within Everett? Or what similarities do you see between the two?
Allie, we have a quick question asked by a couple people. Does this show flight path information?
Flight path.
So
No.
information about populations near airports or under flight paths, like around SeaTac, for instance?
It does not, no.
Okay.
The populations near heavily trafficked roadways is just about traffic.
Okay, thank you.
I will just add, thanks, Jen. And I will just add that if you click on the Earth map, you can, there are airport indicators. You can see the little plane. So if you scroll around, you can at least see which communities have an airport within them. Okay, does anybody have any observations that they want to share in the chat from running through the exercise on their own or from what they've noticed from what I've shown? Okay, I'll share some that I found while doing the exercise. So the small town or rural community that I was using as an example ranked a 1 for overall risk. So if we go back up, we can click on that. So now that the map has updated, you can see that that small town or rural community ranked a 1 for overall risk, and the more urban community in Everett ranked an 8. So the small town or rural community was less impacted than the more urban community within Everett for the overall risk. Another thing that I noticed, if we go to environmental exposures, and you select the more rural community and the more urban one, one thing that I thought was interesting was that although the small town or rural community was less impacted than the urban Everett community for environmental exposures, it ended up ranking higher on ozone concentration. Does anybody have any other observations that they want to share that they found?
Looks like Deborah has her hand raised. Go ahead.
Yes, I've got a quick observation or question. I really love this tool. It's very well thought out. I'm curious in regards to comparisons, that can be extremely useful, not only for demographics, but also as things change over time. And it would be really cool if you could select like 1 or 2 different, let's say, counties, and then in the little pop-up window that has all the different breakdowns and other significant data that they show the comparisons side by side. I know that would be helpful for presentations to like city council or different environmental groups and whatever. So other than that, it's really wonderful. It's a really great piece of work.
That's a great suggestion. Thank you. All right, looks like we have a question from Krista in the chat. What is the biggest impact of the tool? And Jen, I'm going to turn that one over to you since I've only been here for 2 weeks. I think you would have a better idea of some of those impacts of the tool.
Yeah, I mean, I think this has been, the tool has just gotten a lot of attention. I mean, the HEAL Act passed, which in part was due to the existence of this tool and the call from communities really to create something like this. And because of the HEAL Act, we're going to have, many of the state agencies are going to be changing the way that they do things, which is huge for that. So, yeah, I mean, I think that's one of the biggest impacts. And there'll be more to come over time.
Okay, any other questions? Or feedback, suggestions?
This is Kathleen. It would be easy to spend like 2 hours just wandering around and clicking on things and comparing things. And thank you. And yeah, it's a marvelous, useful tool.
Sierra, do you have your hand up?
Yeah, I just wanted to say, we spent the morning talking about the HEAL Act, and I was wondering if one of you would be up for talking a little bit about like the upcoming work on the map and maybe sharing with people how they could engage in those listening sessions or be engaged in the work the Department of Health will be doing under the HEAL Act with regard to the map.
Yeah, so because Allie just started, we haven't done a lot of that preparation of what's coming next. We know that we are going to be working with Front and Center to hold more community listening sessions around the state, but where those are going to be, we're not quite sure yet, and that is to come. I mean, I think the biggest thing is to use that email address in there to connect with us, and we'd be happy to give any presentations to communities about the map, et cetera. But I think that's as far as we are right now.
Thank you. We have a couple of suggestions in the chat. Any thoughts about adding pregnant women as a filter? So that could potentially be something to include under sensitive populations. That's a great idea. Has that one come up before, Jen?
Probably. It probably has. Yeah.
And then the other suggestion is to include an animation feature to show how these data change over time. And that is one of the goals moving forward, is to look at changes over time. And so I've already started kind of exploring some options for how we might do that, but that's more to come. Air traffic pollutants tracking. Thank you. Yep. Modeling future. Yep. Yes, we will put that contact email in the chat again. Jen, do you have that offhand, or do you want me to pull that from the website? The EHD map inbox.
This is a bit too extensive to write, but I find it amazing that the stark contrast of areas of wealth as opposed to poverty, like along the Puget Sound waterfront area, how pristine the color is compared to urban core.
Yeah, great observation.
Well, I hate to cut this amazing conversation short, but I think it's time for us to take a short break before we move on to our final presentation. Thank you both so much. Clearly, you've piqued all of our interests, and we should have a whole other session on this and keep on playing with that great tool. So thank you both so much for presenting.
Yeah, you're welcome. Thanks for having us.
Thank you.
Mhm.
Take care, everyone.
Bye.
So we'll take another short 5 to 10 minute break, and then we'll come on back for our last community session.